Today, the head of the Division of Pulmonary Sciences and Critical Care Medicine at University of Colorado School of Medicine explained the pandemic from a doctor's perspective. Dr. Moss and his coworkers care for some of the 36,047 Coloradans hospitalized in this pandemic. More than 7,000 of those have died. Right now, 796 people are in the hospital with COVID. 87% are not vaccinated. Dr. Moss describes the pandemic fatigue.
Governor Polis, thanks for the invitation to share my experiences from the front lines. As the head of the Division of Pulmonary Sciences and Critical Care Medicine at the University of Colorado School of Medicine and an intensivist at the University of Colorado Hospital, I've been personally caring for COVID patients over the last 19 months. When I think back to our previous press conference on March 30th of 2020, I realize our state and country are at an important crossroads regarding this pandemic that fortunately has at least one straightforward solution: getting vaccinated. In the intensive care unit, we have been caring for the sickest COVID patients as a unified and collaborative team, together with nurses, respiratory therapists, physical and occupational and speech therapists, pharmacists, dietitians, environmental service and transport personnel, and other support staff. ICU providers across the state have been working tirelessly on behalf of all COVID patients. It's been a privilege to care for these critically ill patients and help support their families in times of crisis. Caring for COVID patients has been emotionally challenging. Prior to the availability of vaccines, frontline providers were literally putting their lives on the line for their patients. However, there was a sense of purpose, driven by a common mission that COVID patients needed our help. It was what we were trained to do. We stayed in patients' rooms and tried to diminish their sense of isolation because their family members were unable to visit the hospital. We held a patient's hand and tried to provide reassurance, and sometimes we held patients' hands while they died. It's been an honor to witness my colleagues' extraordinary and relentless efforts. As the struggle to care for COVID patients continued throughout the fall, the availability of an extremely effective and safe vaccine, whose development is truly one of the greatest achievements in modern medicine, created a sense of optimism that the pandemic might end. After receiving my first vaccine shot in our hospital auditorium, I cried with joy when I realized I might not die in the line of service. And with a sense of relief, I immediately returned to the ICU to care for my COVID patients. There was hope. However, that December sense of hope now seems short-lived. Unfortunately, the pandemic rages on due to inadequate vaccine rates, resulting in many consequences. First, the care of non-COVID patients is being hampered due to the necessity to shift resources and personnel to care for COVID patients. Across the state, some elective surgeries are being postponed again to free up hospital beds and medical personnel to care for the COVID patients. Second, as the virus continues to mutate and surge, vaccinated immunocompromised patients are contracting COVID because inherently they are unable to mount a sufficient immune response. Third, as the governor mentioned, the number of pediatric COVID cases rises, and pediatric hospitals are starting to have to care for pediatric COVID patients. Fourth, patients suffering from post-COVID symptoms are seeking medical care at exponentially increasing numbers. As a result, the need for these post-COVID services is beginning to outstrip the supply of healthcare providers capable of caring for these patients. Finally, COVID has accelerated the parallel pandemic of psychological distress in healthcare professionals. The new wave of COVID patients in predominantly unvaccinated people may ultimately break the souls of my colleagues. We will continue to provide excellent care to our patients, though many healthcare workers are simply exhausted. According to recent studies, 1 out of 3 frontline healthcare workers are considering leaving their profession in the near future. Due to groundbreaking research, we understand the coronavirus much better than we did at the beginning of the pandemic. It is an ever-changing and elusive pathogen. Prior to the pandemic, I'd never cared for a husband and wife or 2 sisters in the ICU at the same time with the same disease. COVID and the Delta variant are still ravaging our communities and is not an individual rights issue, but a public health issue. The virus is the enemy. Even with their highly contagious Delta variant, the now FDA-approved vaccine is safe and remains extremely effective for preventing severe disease and decreasing your risk of transmitting the virus to other people. The people who remain unvaccinated not only put themselves at risk, but also their families, their children, friends, neighbors, and other members of your community. The decision also holds the future of healthcare at risk as frontline workers contemplate leaving healthcare. This pandemic has caused enough economic loss, sadness, tragedy, and far too many deaths. On behalf of the tens of thousands of healthcare professionals in the great state of Colorado and the other frontline workers who have worked on your behalf, we urge you to get vaccinated. No one else needs to die from this preventable disease.